this regard?
No, the Attorney General's report was that we need all these pieces working together. That it's too soon to make conclusions about global payments. And as I said, I notice people read between the lines. No, there are a lot of different strategies. Accountable care organizations, global payments, integrated care, they're kind of interchangeable terms in many respects. The idea is to get more coordinated care, which is better care in the view of the medical professionals at lower cost. And I think we can do that.
Who right now do you feel like are your biggest detractors, and how are you going to fix them?
I don't think what I'm experiencing, and maybe Secretary, you should jump in. I don't think what we've been experiencing are detractors. I think that there is a lot of consensus about where we want to end up and the value of that in terms of the quality of care and also lower costs. I think people are, in some cases, really nervous about how to get from here. It's the next couple of years that folks are worried about. And I think, my point is, don't be afraid of the uncertainty. We know where we're going. And we will, if this coalition hangs together as it has for phase one of healthcare reform, then we will make adjustments as we go, but we got to move.
How about Sullivan's idea of just go ahead, go for it with this whole insurance?
You're talking about the regulatory part of it?
Yeah.
I'm going to look at Lynn because I know she wants to say something about that. Yeah. No, I only heard about his about that point as I was coming in, so I don't know.
You can tell I didn't hear much more than that.
Is that right? Yeah. No, I mean, look, the IG's been terrific, and he is concerned about something I'm also concerned about, which is that folks are renewing their provider-payer contracts and locking in rates that have an upward influence on premiums, right, when we're trying to level that and push premiums down. So I see what's motivating that. But look, we got an opportunity here for a comprehensive solution. It's hard, no doubt about it, and it's complicated. But I think we ought to be trying to deliver the comprehensive solution.
Governor, just to expand on that, you said you would like a bill this fall. The legislature, in their public statements, it seems to suggest a longer timeline, maybe next spring.
Yeah.
What the IG said today was to pull the regulatory piece out of your bill and pass it immediately.
I heard that.
Do you support that?
I want a bill this fall, the whole bill.
Governor, when you travel around the country, people come to you and talk about Massachusetts, what's working, what's not working. What are the key messages you give to people with their concerns about what's happening in Massachusetts and what that means for Accountable Care Act?
A big part of what I have found around the country is debunking some of the misinformation which has been passed around about Massachusetts. For example, that it's busting the state budget when it's added, according to the Mass Taxpayers Association, 1% in state spending, or that we aren't reaching the numbers of uninsured when in fact we have 98% of our residents insured, or that the crowd out issue, does that term mean anything to you? That employers were going to walk away from providing insurance to their employees when in fact the opposite has happened. So I think some of it is just the responding to the misinformation which I think has been put out there as a way to discredit the Affordable Care Act, the national health care reform. I think people are also surprised to appreciate just how much emphasis there is on private sector solutions in this bill. This is a hybrid. This is not a government solution, and I think in that respect it responds to a lot of the needs and interests of our broader community, and also delivers a result.
One of the things that we're seeing is Governor Romney sort of doing this dance. There's parts of this universal health care law that he takes credit for, part he's distancing. What would you tell him if his advisors called you up and said, how do you go forward? You're running for president. You want to take some of this?
You think that's likely to happen?
How would you?
No, look, I have a tremendous respect for Governor Romney's role in healthcare reform. As I said, he was part of a very broad coalition of interests, and his role, and he's entitled to, I think, credit for helping to make it happen. And I give him credit, and I don't do that tongue in cheek. Mm-hmm. I think that anything that does this much good for these many people is something that you ought to wrap your arms around, and I certainly do.
Yeah,
Last
but what's
question.
up with his denial?
Well, you have to ask him that question.
Can I ask one more? You mentioned in your remarks about the price disparities and not wanting to lock them in
Right.
any kind of ACO.
Right.
How do you get at that issue?
Well, I
that
think
problem?
one strategy, and it's just one strategy in the bill, and maybe Secretary, you want to speak more to this, is making explicit what I think is implicit in the Commissioner's regulatory authority right now, which is when the Commissioner is examining the bases for premium increases, explicitly looking at what the influence of those underlying reimbursement rates are on those premium increases. Now, our view is that authority is implicit because you got to look behind the rates if you're going to determine whether the increases are reasonable. But making it explicit, I think helps.
Thank you, Governor.
How would
One
that address the disparity issue? I mean, would you have to hold some providers at zero in order?
Well, I don't think maybe is the answer, but I think I got to defer to the Commissioner on that.
I think the other thing the governor's bill does, it recognizes that not all providers are exactly the same and makes more transparent the explanations for some of the differences in the rates that we're now seeing, so that we can put to rest this issue about whether every provider should be paid exactly the same.